Hi, everybody. I'm Keisha Shepard. I am the co-chair of the NAACP Health Committee. I just wanted to get started on our event tonight. We have a lot of things planned. We have some great speakers, a great panelist of speakers on the eviction crisis that's about to happen, especially given COVID. So first, I would like to introduce our chapter president. This is the Howard County NAACP chapter president, Willie Flowers. Are you there, Willie?
Here I am. How's everybody? I want to, first of all, just acknowledge that this is a new day in America, right? And we've all been working very hard this year to make sense out of what a real revolt at the ballot box looks like, and really applying what I think is equity. So they're like equity in two places. That's at the bank, because you can always give a $100 account, and you can always vote. And as you know, in our branch and in the state of Maryland State Conference, and in the national organization, we fight for the ballot, and we try to create equity so people can have access to making money, so it can be equitable at that bank. So I want to thank the committee for pulling this together. It is consistent with what we do in order to fight for Black African people who are at the bottom of all this, to always be on the forefront of talking about social determinants of health, whether it's education, whether it's economic development, and whether it's technology, because as you know, in the last few months, the reality of technology is extremely important, and we should always be diligent about how we introduce that to young people, whether it's in education or in the community or in recreation. All these are social determinants of health. And our ability to advocate and continue to fight at the grassroots level is part of our role as community organizers, that we achieve and add this whole concentration of reminding everybody in what we do that we should have value. We should put value in every single person in our community. And I'm very happy for this forum. Certainly excited about hearing from our panelists. I saw Jackie on here. Miss Jackie is here. Jackie is a member of the NAACP, all that. And I hope the other two panelists are too. I know that Quentin is coming for the second time. So if you didn't get him first time, I hope he's joined this time.
I don't know if you saw that slide. I put join today.
I don't know Scott, but Scott, you got to put in, brother. So, but I'm excited to hear what information you have. I see big brother Chuck Fuller in the house. So I'm very excited about this. So I'm going to sit back and let it happen. I do want you to know that since we last met, due to this recent election, our education committee, as you know, rolled out a plan to review and do a forum with all of the school board candidates. And we made 5 recommendations, and 4 of our recommendations for, to support in this election, 4 of those candidates will be sworn in, I guess, at the end of the year or in January to the Board of Education. And the other most exciting part of what we are talking about, because criminal justice is one of those social determinants of health that can determine a person's life and the health outcomes of their family. Because if you're in jail for something you did not do, you can't make any money. But to that end, our vision is not just to look at the very popular aspect of police being the only pitfall in criminal justice, but the entire system, from the actual call to the police arriving, to the prosecutors who are overfunded, to the defense attorneys who have less funding to support people who are in these cases, to the judge. And speaking of that judge and that whole process, we helped to elect Quincy Coleman, who will be sworn in also, I guess at the end of the year, at the beginning of the year, as a judge in the circuit court. So this is kind of the actions that the NAACP has been involved with. Our branch is on the forefront, and we continue to have these ideas. Again, I want to acknowledge the committee for pulling this together to keep us in the community. Even though we're virtual, we're still getting it in, right? So I'm going to thank y'all, Keisha and Jerry, for the work you've done, and I look forward to hearing this forum. So let's make it happen.
Thank you, Willie.
I've been asked to open and to close this meeting with meditation. I know many of you practice meditation, and there are many publications of its health benefits, especially in a time of COVID-19. The purpose of this opening is to bring our attention to the present moment so we can focus on what will be said and done during this meeting. We can do this by using our breathing to calm our mind and relax our body. You will be able to use your breathing to bring yourself into the present moment anytime during the meeting. I will ring 2 bells. On each ring, take a deep breath, slowly exhale, and feel the freedom from extraneous thoughts and the relaxing of your body as you bring yourself into the present moment. Take it everybody's in the present moment.
Yes. All right. So I'd like to introduce our first speaker of tonight, Ms. Jacqueline Scott, who goes by Jackie. Jacqueline serves as the director for the Howard County Department of Community Resources and Services. Her agency is responsible for serving Howard County residents across the lifespan. Much of Jackie's professional career has focused on improving the quality of and access to health and human service systems of care for vulnerable populations. The scope of her responsibility includes 9 offices, 10 boards, and commissions, and specific county-wide emergency management functions. Jackie holds many degrees from Georgetown University, including a Juris Doctor from the Georgetown University Law Center and a McDonough School Master's in Leadership. Jackie is also a 2004 graduate of Leadership Howard County. So with that, I'd like to welcome Jackie, and we can get started with our program.
Well, thank you, Keisha, and thank you everybody and Willie for having me. You know, I'm always happy to be here amongst friends and folks that I can call family. And I have to tell you, I don't know if it's anybody else, but I felt like I was awake for a whole week last week from Tuesday to Saturday, and so I think I'm still trying to catch up on my rest. But as Willie started out the conversation, it is a new day. I am here. I want us to really be able to have a conversation, but I just want to begin by sort of saying to you all, you know, we are, and you hear it a lot, we're in unprecedented times. We are at a place at which we have not seen ourselves before with COVID. But really what COVID has done is this just pulled back the Band-Aid off the scabs of what we know has been disproportionately affecting African-American communities throughout this country. And what COVID has shown is that all the systems that have traditionally been in place and the hills that African-Americans have had to climb exist tenfold in a COVID environment. We are finding that across the lifespan, from our very youngest to our very oldest, we are facing unprecedented numbers of displacement in the African-American community and of communities of color, including the Latino community. We are being hit across the board in all of the, all of the areas associated with the social determinants of health. So traditional health, but all the public health measures, where we live, where we work, where we play, all of those things. So economically, job loss, our health we are being hit in tremendous numbers. And education, the gap is growing during this time of COVID and remote learning, mental health, emotional health, behavioral health, and then our conversation today around housing and the housing impact. And while we live in a wonderful community, Howard County is not immune from the disproportionate impact that these things are taking on our community. Now, it's very hard to give you definite numbers around this conversation today, but I'm going to give you a few estimates of where we think we are to launch our conversation, and then hopefully it'll be enough for people to start asking some questions. And I know both Jerry and Keisha have some teed up for us. But what we are estimating in terms of evictions, in terms of housing instability, it is potentially in, you know, the thousands of households that could be affected here in the county. We are looking at potentially research that has said that there could be up to, 3,000 to 4,000 households affected by either a loss of job and therefore falling back on their rent. Not to say all of those people will end up being evicted, but their housing stability is at stake. And they are then housing insecure. If you go and you fall behind on 1 month, then you're behind on the second month, you're behind on the third month, if your jobs haven't come back online. And we know what we're experiencing even today, that COVID is raging, and it's very unlikely that people will be getting back to any semblance of normalcy for some time. So what that means is that we have families that are at risk in this county. What we have done, and I say we in terms of a county, our department working alongside housing and our other agencies, is to try to do significant levels of outreach, to be available, to provide landlord-tenant information, to be able to do the outreach that informs people of their rights. As you know, we have under one of our offices, one of our 9 offices is the Office of Consumer Protection. We have seen a significant increase in inquiries with regards to tenant and landlord disputes, people who are seeking to understand their rights around landlord-tenant and evictions. We have worked closely with the housing department as they're moving to give out the dollars and facilitate those dollars going out to the community. And to date, we estimate that it's been over $2 million that has gone out into the community, closer to almost $3 million, with more coming. And what has happened is that there's been a CARES Act county initiative through the housing department where we have awarded funds to nonprofits to then get those funds out to the community. So there was the CARES Act rental assistance that went out earlier this summer, and there were grants to 6 nonprofits that went out to them, and they served an average at that point in time of 248, 250 households, and provided up to 3 months of rent coverage that was past due at that point in time. And the average grant that they gave out then was over $3,000. Then there was there's additional round of disbursements coming as of this week in November to another 195 households or more, again, paying on average about a 3 months rent. So what we're looking at is people who are coming forward who have fallen behind, and the use of those dollars from the CARES Act that we're trying to get to those communities. And so what we know though is that there's more to come, because these were during the times of moratoriums before people were being evicted, or at least the court system had put things on hold. And so as we talk today, I can share a little bit more with you in terms of what we have physically done, what we're planning to do, but also what you can do to help and protect yourself. But I'm going to stop there, and I know my introductory time is up, and hopefully we'll have some questions after Scott gets a chance to talk. Thanks, Keisha.
No problem. Our next speaker that we have is going to be Scott Gottbrett, and he is the Associate Vice President of Homeless Services at United Way of Central Maryland, where he has managed homeless services programs for 8 years. Scott has worked extensively on homeless outreach initiatives. He has worked extensively on homeless outreach initiatives, including Project Homeless Connect. This project links individuals and families to direct on-the-spot services such as dental, vision, ID, employment assistance, and housing. To date, more than 10,000 homeless and at-risk people have received services through this program. Scott also oversees the United Way Family Stability Program, which helps prevent homelessness for more than 500 families each year and ensures that children can succeed in school despite housing insecurity. Scott recently earned his PhD in comparative thought from Johns Hopkins University, where he specialized in interdisciplinary approaches to addressing homelessness. So with that, I would like to introduce Scott.
Good evening, everyone. One of the concepts that I like to introduce about when we're talking about the COVID-induced housing crisis is this notion, by way of an analogy, that COVID tends to affect or have the most severe implications for people who had a pre-existing condition. And I contend, and I think many of you will agree, that America had a pre-existing condition prior to the onset of COVID with respect to economic and social vulnerabilities and housing vulnerabilities, including and especially for communities of color. And so these pre-existing conditions those are some examples of these pre-existing conditions, and COVID came on top of these and exacerbated these pre-existing problems. You know, educational disparities, housing disparities, income disparities, wealth disparities, savings disparities, you name it. And COVID has made the situation worse and exploited those vulnerabilities. So I think that's a very neat metaphor, and you're welcome to take that to your other social circles as long as you credit me for having come up with that. So let me give you an example. So one statistic that I've identified is that for every 10 low-income households in Maryland that needed affordable housing prior to the onset of COVID, there were only 3 units of affordable housing that were available. Let me restate that for every 10 people who needed affordable housing, there were only 3 units of affordable housing available. So that means 7 out of 10 people who needed affordable housing didn't have access to it in Maryland prior to COVID. And that means that when these households, and there's this magic number that many of you may or may not have heard about, it's this 30% number. So experts from all walks of academic life, from economics to political science and, you know, in government, the housing and urban development, everyone seems to agree on this sort of magic threshold that you should not spend more than 30% of your income on housing. And that's gonna be an important number later on. So remember that 30% of your income on housing. Because if you're spending more than 30% of your income on housing, you're having to make cutbacks in other areas of your life, like food or transportation or healthcare or childcare. You're having to make sacrifices elsewhere in your family budget in order to sustain the high cost of housing. So for 7 out of 10 low-income people who don't have access to affordable housing, they're having to make sacrifices elsewhere in their lives. So that means they're having less quality nutrition, they're working more jobs than a single full-time job, and that leads to things like chronic stress or less time with their families. And you end up with folks who are working 2 and 3 jobs and they're never home. And those disparities, I just sort of provided a snapshot of the lack of affordable housing for low-income renters. Those disparities, believe it or not, are not felt equally across all racial demographic groups. There's a concept that we at United Way like to talk about called ALICE. It's an acronym that stands for Asset Limited, Income Constrained, but Employed. So it's a term that we use now to talk about basically the working poor, but it's a more realistic snapshot of the expenses that households will incur over the course of a year and what it costs to maintain a household. And the federal poverty data really only looks at things like how much food costs, how much your utilities cost, and how much your rent costs. But we all know that does not capture the adequate realities of what an actual household budget looks like. You have things like transportation, childcare, healthcare, cell phones. And so United Way has introduced this ALICE concept that accounts for all the expenses that someone would have in a given year. And if you're below that ALICE threshold, you're having trouble making ends meet. Well, white households make up 67% of the ALICE population, or of the US population, but white households only make up 58% of the ALICE population. So white households are less likely to be struggling to make ends meet, is what that data indicates. African-American households, by contrast, make up 12% of the US population, but 18% of the ALICE households. And to make matters even worse, white households are impacted by COVID deaths only at 51% of COVID deaths, where African-American households are impacted at the rate of 24% of COVID deaths. Yet they only make up 12% of the American population. And you've heard this statistic, I'm sure, bandied about, that African-Americans and people of color are more likely to be hospitalized for COVID or to die of COVID. They're less likely to be able to access healthcare systems. They're more likely to be required to take public transportation as their means of transport, and more likely to contract COVID. And so across every indicator, communities of color are suffering more as a result of COVID. And so we need equitable responses to that. And African Americans and communities of color, people of color, were more likely to be working in frontline jobs like the healthcare industry or janitorial industries that have to be out there no matter what, even despite the fact that COVID's out there, or they're more likely to work in industries like food service for folks in the Latinx population, and more likely to be laid off when the crisis happens and folks have to leave their jobs. So they're more likely to be impacted financially. The example of United Way in Dallas is a case that I like to point to of what an equitable approach to dealing with the COVID crisis looks like in the housing space. So the Urban Institute designed this tool that identifies census tracts where there is a high concentration of racialized poverty, where there's high housing instability, and where there's a high number of high instances of COVID. And so those three indicators suggest where there are basically hotspots for housing instability and poverty in communities. And communities can use this tool to identify where they're going to target a limited set of eviction prevention resources. Because there's not enough money to go around, so where do you use it? Well, the Urban Institute has designed this equity tool to help communities prioritize eviction prevention assistance. And United Way of Central Maryland is now adopting this in Baltimore County to help them identify where to distribute eviction prevention resources and to target communities who are likely to fall behind and likely to already be struggling. So that's a race equity approach to the housing crisis that distributes resources with racialized poverty in mind, with COVID vulnerabilities in mind. And that's the sort of forward thinking that I think that we need to be having right now and that we need to be discussing is what's a strategic use of limited resources to help the most vulnerable, those folks that are most likely to be economically, socially, and impacted from a public health perspective. So that's my take there, and I'm sure there'll be a lot more coming up in the questions. I'll stop there.
Yeah, we actually have our first question in the chat for you if you want to take a look, Scott. It says, where can the ALICE data be accessed?
UnitedForAlice.org. And yes, Jackie also put uwcm.org/Alice, and I'll put the link in the chat, and I can give you just the direct link to the Maryland data, as well as the website for the ALICE project as a whole.
Thank you. All right, and I do want to say, if you do have questions for the panelists, please go ahead and add it to the chat. If you are accessing online, there should be links available so you can join our Zoom and ask questions as well. So thank you so much for your question. I have my first question ready for you guys. With COVID-19 cases at an all-time high, eviction protections ending in December, and no continuation of income support payments, will your system of resources and services be completely overwhelmed by evictions this winter?
So I'll start, and then Scott might want to jump in. So I know we will have significant increases, and I think our system will be taxed. I'm hopeful that we will not be totally overwhelmed in that nature, in the sense that we are trying our best to prepare now. What is of concern is that the safety net has now had to be expanded so much larger to include what the population that Scott indicated, the Alice population, in addition to people who just have never found themselves in this position. Business owners, other people who've had to shut down, they've lost their businesses, people who for any other time would not have need. They have been able to, take care of their families, they own property, all those kinds of things. But there's mortgage assistance, there's rental assistance, all those things needed. So we do anticipate a significant increase in this. And so we're trying to build the capacity now to be able to handle those and to be able to draw down other funding streams so that we can support those efforts through either other mechanisms. For example, we get HUD dollars and other things that could be able to be used to help people in this situation. So the short answer is yes and no, that yes, we expect a lot. We hope not to be totally overwhelmed.
How about you, Scott?
Yeah, that's a great question. I think it's going to be very tough. The R211 call center is sort of the front line for responding to a lot of these crises. And Quentin was going to be on tonight to talk about 211, but let me just plug it. We call it Social Services 911, or I call it Social Services 911. And it's a call center that's staffed entirely by folks with master's degrees in social services or related fields. That folks can call. It's your first call for help, and they can connect you to any one of 40,000 different resources in the Central Maryland region. Folks call for energy assistance, utility assistance, eviction prevention, childcare. They can't put food on their table, and so we have callers calling for any modality of need. Typically, we see 100,000 calls in the Central Maryland region per year to 211, and that number has more than tripled in the months that COVID has been impacted. Governor Hogan has been mentioning 211 in press conferences, and we have staffed up to meet the challenge that COVID has presented, and we're able to still answer those calls. We have teams of volunteers. We've grown our staff capacity. I think it's going to be even more that when the eviction crisis really sets in. The Aspen Institute, which is a major think tank in the housing space nationally, estimates that nationally 30 to 40 million people could face eviction by the end of the year. That's one of those alarming statistics that people like to throw around, but that's a lot. That's a lot of people.
That is a lot of people. That is a lot of people.
If you think about it for perspective, in the really the 10-year window around the Great Recession, there were about 10 million folks that faced housing instability, that faced foreclosure or eviction in that 10-year period. And so we're talking about 30 to 40 million people in 10 months. And the Great Recession was 10 million people, a third to a fourth as bad in 10 years. So the scale is greater than the Great Recession, and the time, it's the collapse time period in which this crisis is going to take place is much more intense and severe than the Great Recession. So definitely fasten your seatbelt. But our 211 system has staffed up the capacity to meet this demand. And I think, Jackie is correct. We're going to be tapping a lot of sources, but we're going to run out of money. There is a lot of need out there, and this demands sort of a government level response. And there's a big chunk of money that's sort of built into the HEROES Act at the federal level. That's like the CARES Act. It's, CARES Part 2, and it's just sort of held up at the federal level. And we're really counting on that money trickling down in order for states and localities to be able to implement the kind of scale of response to the eviction crisis, the sort of rental assistance that's needed. United Way, our dollars are sort of nickel and dimes that we get from donations when we're out pounding the streets asking folks to help. And our money makes sense. It's very flexible and can be used to plug gaps in the system. But government money and federal money is big money. There's a lot of it, and we need the HEROES Act to be passed in order to have the resources at our disposal in order to be able to combat the crisis. So it's a scary time. Our system has the capacity. We need a fresh infusion of cash. Until then, as Jackie said, localities and states are going to be tapping every resource they can think of in order to continue to try to get resources out to the community and stop folks from becoming evicted. So we're trying our best. We're going to make do with what we have, and we're hopeful that the new administration will be able to pass the HEROES Act through Congress and get money into the hands of folks who need it.
Excellent. It's very interesting to hear that 40 million number thrown out there. And when you think of it down to the Howard County level, being thousands of people that are going to need this, it's very interesting just to put that into perspective. A lot of people are going to be needing help. And if they do need help, we do want to definitely plug Maryland 211. And all you do is dial 211 on your phone and you will have access to resources and somebody will answer the phone. It's 24/7. So definitely want to plug that. Thank you for doing that, Scott. And also, again, if you guys have questions, go ahead and put them in the chat. Our next question is, what will be the challenges of eviction to individuals and families for poverty, homelessness, mental health, physical health, and stress?
Scott, you want to go first this time, or you want me to?
You can go, Jackie.
Well, I think a couple of things. One is just basic access. When your housing is unstable, just to have continued access to the daily needs of life are so difficult because of the transient nature and just the literal stress, right? So you're looking at multi-generational stress. The parents or heads of household are stressed, but then the kids are trying to learn. They're moving around. I mean, the family level dynamics are significant, and having access to the supports and then just knowing where they are and how to get to them and not have them be so strenuous in terms of getting them. Having things be able to be easily accessed, not having to be able to go and have to fill out 20 different forms every place that you go, for example. So we're trying to think forward about that. The other thing is there's going to be for us a significant challenge for people to be able to remain in Howard County because it is so expensive. And once you fall on that cliff and you're vulnerable, getting back up is a challenge to cover that gap. And so families are challenged all around. And then third, I would just say the consistency of care. In that if you have if you're dealing with these multiple things that you mentioned, your physical health, your location, your job, your mental, socio-emotional health for our young people, having access to the doctors, the medical care, the continuity of people in your life that provide the stability. And so we're, building those support systems and having case managers and people that can actually find people and keep touch on them and keep that safety net there for them is a challenge for both those people and for those of us who are trying to serve them. So there are going to be significant challenges that once your household is shaken and you don't have a place to live, that stability just falls. On it, everything else falls on the wayside.
Yeah, thanks, Jack. I mean, that's I want to echo that. It's very traumatic. I don't want to scare people who may be on the brink of facing eviction. It's a very traumatic experience. It's very unsettling. For children, it's a traumatic experience to not have the stability of the home, but there's also, our program, our family stability program, that is an eviction prevention program that pairs eviction prevention assistance with case management. We have a site in Howard County that serves 20 to 30 families per year. Our research in support of that program suggests that every time a household experiences instability and children have to move schools, it puts them 3 months behind in their studies every time they have to move schools. I think that's an underestimate, but think about it from the child's perspective. Having to have a new classroom, new textbook, new teacher, new friend group, new route to school, you name it, it puts them 3 months behind, and that can be a significant driver of being held back a grade or dropping out. And so it's very challenging for the children, it's challenging for the household. I don't want to get into all the statistics about what chronic homelessness does, because I don't think that's exactly what we're talking about here. We're talking about the eviction crisis and what a family dipping below the point of stability looks like, or what the impact of that is. I really think we're going to see a lot of folks shifting to living doubled up again. And doubled up is living with friends or family out of economic necessity. When you're in college, it's called couch surfing. But when there's an economic crisis, it's called living doubled up. And I think we're going to see a lot of families shift to that as they try to rethink what their household obligations and budgets are. And that can become stressful. And those situations are tenuous. You know, we get a lot of calls at 211 from folks that they had a housing arrangement that was sort of informal. They're staying with Aunt Lisa. I made Aunt Lisa. I don't know who she is, but I'm always talking about her. They're staying with Aunt Lisa, and it sounded like a good idea to move in with the 2 kids. But next thing you know, the 16-year-old's getting into trouble and the toddler's just screaming, because I have a screaming toddler myself. And nobody wants that. And the open invitation to come live with Aunt Lisa suddenly kind of dries up, and now that household is threatened with instability and doesn't know where to go and how to start back over. And it can be a very stressful situation, very confusing. And so again, we're really trying to avoid that. I think for every $1 invested in eviction prevention, we save $4 further down the line in cost to the social system that would be needed. Things like shelter stays or food stamps or whatever. When a family becomes unstable and not self-sufficient, it's very expensive for the social system. We think at United Way that an ounce of prevention is worth a pound of cure. And we are interested in investing in the ounces of prevention and stopping those costs further down the line. And this is the time, I think, when major systems like Maryland State Government, Howard County Government, United Way need to be really looking upstream to figure out where we can make those strategic investments and prevent families from being displaced in the first place. Because if we have people, thousands of people displaced, it's going to be an absolute catastrophe. We need to keep those families in their homes, and that's the strategy, I think, for getting through this.
The chat is blowing up with questions right now, which is great. Keep them coming. One of the first questions is there resources for homeless veteran populations?
Yes. There are. So if you do know of a homeless vet, please refer them to our office, to our department. As you know, many of you may know, we are the coordinated system for homeless services for the county. We also have an Office of Veterans and Military Families, and there are particularly focused programs for our veteran populations to be able to move them up, on the list quickly to have them housed. The difficulty is that sometimes based on the needs, there's not a guarantee that they're actually housed in Howard County, but the surrounding counties that work with us, but we do target and try to reach out. We also have a Veterans Services Administration person in our multi-service center when we're physically there, but you can also reach them by phone, that is trained to deal with all the various benefits and programs available to veterans.
That's great. In United Way, do they have anything for veterans?
Yes, absolutely. Veterans are a special class that has a lot of funding behind them. There's money for veterans. It comes out of a whole range of budgets. So the 211 call system can link folks to the appropriate funding stream. It's a little tricky because, there's this not stereotype, misconception that you have to have what's called a DD 214 in order to be considered a veteran and be eligible for veteran services. And that's when you've had like an honorable discharge and all your paperwork's in order. But a lot of folks, they left for mental health reasons or for a variety of reasons, didn't have necessarily a clean exit from the military. And those folks sort of just feel like they're ineligible from services. Let me dispel that stereotype now. You are still eligible for a wide range of services. And so folks who have experience with the military, who've served in the military, regardless of their discharge status, regardless of their military documentation, should still present to folks like 211 or Howard County and say that they were in the military and want to know what resources are available. There's a lot of misinformation out there about veterans and about military experience. Regardless of how you were discharged, there are resources out there and folks should identify as having served in the military. And with that said, we also have a very special program, our Veterans Treatment Court, that works with folks who had served in the military and have had run-ins with the legal system. The court system provides for case management and peer mentoring to walk folks with experience in the military for veterans to get connected to services instead of jail time. So if there are folks who have served in the military and have had run-ins with the legal system, let us know and we can connect you to this treatment program. Basically, the judge says, you know, instead of I order you to 90 days of jail time, they say, if you're willing to participate in 90 days of treatment or 90 days of case management, we'll waive the, charge. We'll drop the charges and you'll be free to go. So it's a diversion model that's an alternative to disciplinary tactics. It gives veterans an opportunity for services as opposed to punishment. So it's a great program. Again, that name is the Veterans Treatment Court, and I'd be happy to connect anyone to that program.
That's great. Thank you. So that was very interesting. I did not know that no matter how you were discharged, you have access to veteran programs. It's really powerful to know. And having, like, again, you just need to connect to the right people to get to what you need. And we also, I remember I watched one of your videos, Scott, and you mentioned how people were behind in payments. And whether you're a renter or a homeowner, you're going to be behind in payments. And I see a question in the chat that, are there services for homeowners that are behind and maybe facing or struggling with their mortgage and things like that with Maryland in Howard County?
Let me answer that. 3 bullet points. Number 1, yes, absolutely. Most of the programs for eviction prevention are also for mortgages. Not every one of them, but the same sort of places that you would tap to try to get eviction prevention assistance, talk to those folks about mortgage assistance. And usually there's funding streams that can be tapped to get there. The second thing I was going to say is that I've heard from a lot of banking organizations that they're being incredibly flexible with homeowners right now on forbearance, on restructuring their loans, on delayed payments. And so folks really should be encouraged to talk to their lenders. Because no one wants to see a family default. The vast majority of families that are falling behind right now, it's just a blip. They lost some hours, they got unemployed, but as the economy is restructuring and the unemployment rate is decreasing, banks feel like that they have a really good chance of recouping their money if they just give families a little bit of extra time. So they're being very flexible right now. Talk to your lender, don't be shy. There's some sticker shock that goes on for families when they get behind and they get afraid to open their mail and to talk to their landlord. I'll tell you, my experience has been every single time a family opens up a chain of communication with their lender or their landlord in this COVID context, they've been willing to work with them. They can set up partial payments and everything, but that chain of communication, that line of communication is the key. When that chain of communication breaks down and folks aren't talking to their landlords and aren't talking to their lenders, the lender or landlord has no choice. They have to do a foreclosure. They have to do an eviction. They don't, they have no other choice. But when you actually open up that communication, I've seen those be successful almost every single time. And the third thing I was going to say, just real quick, is for those of you who are, who are behind on rent or who are behind on their mortgages, one of the best pieces of advice that I can give to anyone who's on that side of the equation right now in the economy is document your losses somehow. If it's lost wages, if it's, if you've had reduced hours, if you've been laid off, if you got COVID, if you had to quarantine for COVID, get any documents you can to try to make a case that you've been impacted some way by either COVID or the current financial crisis or by, job loss or challenges in the labor market, because those are going to be your ticket to most of the assistance that's out there right now. So, when on a service provider side, when I get a call from someone who says, I'm behind on my rent, one of my first questions is, can we get some documents together for you that make a case that you've been impacted by COVID? And if you can, then there are pots of money we can tap. But if you can't, your options are a lot more limited. So getting that documentation is basically getting your ticket to assistance. And so start thinking early on, how am I going to be able to prove that I had a reduction in hours, that I had labor force problems, I had health problems? Document that. That's going to make the world a difference for you.
Jackie, would you like to add anything?
I was just going to add that the money that's being processed now through the nonprofits that's coming out of our Department of Housing also includes mortgage assistance. So those applications are being taken for both rental assistance and mortgage assistance.
Thank you. I'm going to go a little off script right now. there are people that are landlords, and some of them have, tenants that are not paying the rent. And what kind of protections do they have? Can they evict people? Should they not? What kind of protections do you have for landlords?
Well, I do want to, and I'll jump in, and then I'll turn it over to Scott. I want to say that our Office of Consumer Protection takes calls and assists everyone. So the landlord or the tenant, and we will advise them of their rights. There are certainly opportunities as business owners, as business folks, for which they can also calculate their losses and make application for perhaps whether or not they qualify for any of the programs out there to get benefits for those losses that they're taking. What we run into is that many of our smaller landlords here may be renting out their home. They may have lived in a townhome and then they moved to a single family, so they're renting out their their townhome, or they're renting out another single family home. So they have one property or so. And so they're really struggling with what their rights are and where their own losses are. Just as what Scott said to those, they need to immediately contact, if they're still holding a mortgage on that property, they need to immediately contact their mortgage broker and their mortgage company rather, and let them know and talk through the situation, because they, even though they're not living in that particular property, they may have a mortgage on it for which they're using the rent wages to pay. So they need to treat that as if they, just like they would treat their own place if they were falling behind. So there is opportunity out there to get counsel. Also, legal aid is a great place for them to also call and talk to. And so we have a number of community partners who are also giving advice for both landlords and tenants.
Great. Charles, I saw you and did your video.
No, not a question. I had just a point that might be of some assistance to some of those who are facing evictions. This year, leading up to Christmas, my office, along with Giant Foods, is giving away 10 free shopping sprees that may help some of those who are facing eviction, that they participate in this program. There's no charge; it's absolutely free. They can receive a $250 free shopping spree, and if they get that, it may help them ease some of the stress related to potential evictions.
Very good, Charles.
Thank you. I think that's a yearly program, right, Charles?
Well, yeah, we did this, last year was the first year that we did it, and so it went over well, and so we decided to do it again this year.
Okay, well, thank you for plugging that. I'm sure a lot of people will be interested in that as well.
Keisha, what I'll do is I'll try and send you the flyer as well.
Yeah.
I think I sent it to, I tried to send it to Jackie, but I'll try and send it to you as well so that you can have it. And
yeah, definitely send it.
And so it's we're trying to get the word out there for we can accommodate 250 people in this drawing. It's a random drawing, and anybody, as I mentioned, no purchase necessary, and it'll be done just before Christmas. So we think it's a good time for someone to get to participate in this free giveaway. We call it giving back to the community.
Thank you.
Certainly.
All right. I saw another question in the chat. Are we totally dependent on a federal infusion of money to prevent a depression for lower middle income and poor people?
So, I would say that in this COVID environment, the federal infusion of dollars is significant and it matters. We can't get out of this with county allocations only. We have invested, and I think the administration continues to try to invest as much as we can in making sure through all of our agencies that we're able to serve people, but the need is just going to outweigh anything that one county and honestly one state can do. And in a county like ours that is relatively small in size, even our state allocations for certain programs are much smaller than our larger counties, and understandably so, but also at the same time, our need is increasing exponentially. So we are going to need help from the state and from the federal government to get us out of where we are. Now, it's a kind of a loaded question about sort of, I think you might have used the word depression for, lower and middle income and poor people. And I think we all know that, as a country, we're facing significantly, deeper levels of need. And so they're going to have to do something that's going to come alongside. In the meantime, we're, working as a county with all that we can to be able to put into this to stop, kind of put the Band-Aid on.
So I guess I'll chime in. So I think it's a question of degree, right? I think that there are going to be folks that lose their housing as a result of the financial fallout from COVID. It's just, I mean, we're seeing it happen already. Every researcher in this space suggests that there's going to be a lot of folks that lose their housing as a result of this situation. And it's just because, I mean, I think you get it, that folks, lost their jobs, saw reductions in hours, and it builds up and builds up to the point where 40% of Class C apartments right now in Maryland are behind on rent, are delinquent on rent. 40% of Class C apartments. Now, the Class C apartments are they're the cheaper ones. They tend to be older, have less amenities and so forth. So low income renters tend to occupy the Class C apartment space. So another way of saying that is, if you read between the lines, 40% of low income renters are behind on rent currently. And that's an enormous number. And the question is not, are people going to lose their housing, but how many people are going to lose their housing? And it's going to be a lot more without a fresh infusion of federal funds. And I think the state is doing a lot. Howard County, all the counties are doing a lot to move money in the direction of this problem. It's not going to be enough to keep everyone in their houses, but it's going to be a lot worse if we don't have some fresh infusions of funds, for sure. So I don't think it's an either or. I think it's a question of degree and scale. And I'd be worried if we don't have some infusion of funds. And I think it's, you'll hear this said is that moratoriums are basically just, eviction moratoriums are just kicking the can down the road. And some folks even think that moratoriums are doing a disservice to everyone because, you don't pay your rent in March, April, May, June, July, August, and then the amount of rent that you owe is $10,000 and it's an insurmountable amount of money that's owed. And it's this wall of debt. And so moratoriums are just kind of forestalling the inevitable and just making it so that when we do have to pay, it's going to be so much more. And it's sort of preventing a crisis. And I think what has to happen is moratoriums are sort of they're the levee holding back the tsunami of evictions. You know what I mean? They're keeping the water from getting in. But what we need really is a lot of money in the form of rental assistance to go to these households to then, pay their rent and shore up the landlords in order to stabilize the situation. And that's going to take a federal response. We're talking about billions of dollars here. We'll make do if it doesn't happen, but a lot more folks are going to lose their housing if we don't get that money.
Great.
And if I can add to that, Keisha, one of the things that we're talking about to that point is a lot of the programs will pay for up to 3 months that you're past. So if you come in and you're already 3 months behind, you're going to pay for those 3 months, but then 30 days from then, if you can't pay for month 4, you're back into that cycle again. Mm-hmm. And so somehow we've got to figure out how to, close the gap on that. The other thing is that on many of the traditional programs are for deep end poverty programs. And so the people that are finding themselves in need now, from a policy perspective, we have to figure out what's the responsibility and how are we going to help close the gap for those. Because if I own property, if I have a mortgage, then I'm not going to qualify. Or if I make X amount of dollars over the federal poverty level, I'm not going to qualify for those traditional programs. So talk about the cliff. Do we wait until people lose absolutely everything and fall off into deep poverty? Or do we figure out a way to keep those folks stable and not fall off, and figure out how we can close that gap so that we don't have so many people down in the poverty level while we're trying to do the prevention side up top?
Yeah, I want to chime in, Kishik. I want to sort of plug a paradigm shift that we're kind of trying to usher in right now, a new way of thinking. And Jackie, I'd love to hear what you think about this. So you all are now privy to some cutting edge conversations. So what we're trying to pilot in Baltimore County is this notion that the one-off approach to eviction prevention, which we've been doing up till now, is not moving very fast, and it's very challenging for households. The one-off approach basically is where a county announces or makes it known in whatever way possible that there's money out there and that households who are underwater should apply. What that does is it leaves the onus on the household to figure out where the money is, to apply for it, to navigate the complicated world of application windows and deadlines and documentation. And it's confusing, and it's hit or miss for these households, and it's not getting the job done, quite frankly. It has its place, and it's helping, and it's making a dent, but it's not going to be the answer that's going to solve our situation. And what we're experimenting with in Baltimore County is what I'm calling the targeted eviction prevention approach. So like I mentioned, we're looking at census tracts and zip codes where there's high concentrations of poverty, where there's high housing instability, and where it's been severely impacted by COVID. And we're looking at the Class C and Class D apartment complexes there. Those are the ones with the low income renters that are extremely behind on rent. And we're identifying bundles of accounts with landlords that are past due. And we're going to do bundled settlements, where any account that's 3 to 5 months behind on rent, we're going to work with landlords to bundle those up and pay those off kind of in bulk. So what this is a paradigm shift. It moves away from individual households having to sort of jockey for position in line, first come, first serve, trying to get this eviction prevention money. And it moves to a collective approach where we're looking at groups, we're looking at targeted vulnerable zip codes and populations, and we're working with landlords to initiate these payoffs so that it's not even the onus isn't even on the renters. If they're behind on rent and in a certain category of amount of rent that they're behind, we'll work with landlords to pay them off in groups. Right. So you can see how this is an alternative mode of thinking. And we don't think that this is supposed to displace the one-off approaches or that everything that we've been doing up until now has been wasted. That's not what we're saying. We're saying we need to do more. And this is an additional approach that we can come in on top of the existing strategy and pay off as many accounts as we can, settle past due accounts for vulnerable groups. And in addition to that, we can have the one-off approaches for households who are falling behind. But we're introducing sort of a new paradigm in Baltimore County that we're eager to pilot and see, if we can move money quickly, especially this CARES money that has to be spent by the end of the year, has to be spent by December 31. So we're hoping that with this new program model, we can move millions at a time, write checks that are $100,000 to a landlord instead of $4,000 to a landlord. Right?
So is that gonna, if it works, is it gonna kind of go into Howard County as well? Are they doing those kind of analysis on all the counties, or especially with Howard County, because this is our county, but?
We're piloting in November in Baltimore County, so we'll see how it goes, and hopefully it's a program that we can get a lot of mileage on. It's a pilot, so it might not work. We might end up with too many documentation barriers, or household participation, or landlords not being interested. But we're hopeful, and we're absolutely willing to share any learnings we have with Howard County and share this best practice if we can get this really going. And we think that what we're really doing is we're setting up a model for when the HEROES Act comes. I know there's going to, in my heart of hearts, I believe that there's going to be a federal response, whether it's this month or next month or January or February, there's going to be a federal response because if not, it's going to be a catastrophe, and Congress is going to be moved at some point to have to respond to the crisis. And there's going to be billions of federal dollars that become available at some point. And when that happens, we hope that our pilot is a proof of concept that we can move some of this HEROES money quickly and efficiently to deal with accounts that are past due. So we're trying to sort of set the stage for this next round of federal interventions. But for now, through the end of the year, we think that we're going to be able to help a lot of households with this model, and we'll be happy to share any of the details of that if you all are interested.
That's great. Definitely share the details of how that goes. Maybe we'll have you back and let us know. There's a couple more questions in the chat. And again, if you have any questions, go ahead and add them in. We're going to be wrapping up probably. Let's do another 10 minutes. Are there moratoriums in place through the winter months for rental evictions and utilities right now?
Jackie, you can, okay, let me just, so the CDC, what Trump had done is he empowered the CDC to make this sort of arrangement where the CDC called a moratorium, a national moratorium, but it requires households to submit this thing called the CDC, Centers for Disease Control. The CDC declaration, they have to download the CDC declaration form. I'll copy the link into the chat box. They have to kind of sign it and fill it out and give it to their landlord. And if they do, it's a defense that they can raise in court that they are not allowed to be evicted. And so there is basically a national moratorium right now that the CDC has put in place. And in order to participate in that moratorium, renters have to download this form, sign it, and give it to their landlords. So it's kind of a moratorium. Well, yeah, I'll just say that. So that exists now, and I'll put the link to that in the chat. And it may or may not be extended. We'll see, but it's through December 31st. Oh, and let me just add that the Maryland courts have interpreted that to mean that they're not going to actually be providing for evictions to be actioned until January 1. So
okay, so you can still be like, you can still have your landlord file for eviction. It just won't actually happen until January 1. Okay.
Right. So your landlord can file eviction. You can be called into court. You can have a day in court, and you can have an eviction judgment filed upon you. But the sheriffs will not actually come to your door until January 1. So it's a mistake to think that you can't be evicted right now. It's a mistake to think that you don't have to pay your rent. Please be, you need to be paying your rent. And if you don't, that your court will file an eviction in the court, your landlord will file an eviction and the courts will hear that case. But there won't actually be a notice on your door until January 1 right now. That's what the eviction moratorium situation looks like in Maryland. That's how the courts have interpreted the national moratorium. Jackie, do you want to add something?
That was the only thing I was going to add. So I don't want people to think that they are not filing, because they are filing.
Yeah, I know a couple of people that said they filed evictions against people. I'm like, you're evicting people?
And when you see that you see the date will be January something because of this issue. Now, in regular sort of everyday times, BG&E, there are certain things that are triggered based on the winter time. There are certain places and moratoriums on cutting off people's heat and things like that when the temperature goes below certain degrees. And then in certain areas, not as many here in Howard County, but in certain areas of Baltimore City and others, where there are high density, low income housing units, there are some agreements around not cutting people off in the winter time or over a period of time when it's the coldest part of the winter. So as long as people pay something on their bill, they don't cut them off. So but this moratorium, it's while it's still holding, I mean, it's lifted in the sense that people are now filing because the courts have opened back up. So I don't want people to think that, they don't see these things happening, because they will be happening.
Okay. Definitely, what I took from that is still do what you can to pay your rent and don't rely on these moratoriums. And things will definitely catch up with you because at some point they're going to be lifted. I wanted to also we have a question from Jessica. Are there any tax consequences for renters or homeowners accepting assistance funds?
I don't know the answer to that. I'd have to look thinking in turn, I'm assuming they mean, you know, is it considered income
Mhm.
kind of a thing? I don't know I don't think so. I have not heard of that being an issue. I have had some conversations with folks in the social service arena, DSS and others, that are cautious about certain extra benefits that a person might receive, then counting unfortunately against them in an unintended consequence and perhaps lowering their allocations. And so they were trying to look at that and fix that, particularly related to the SNAP benefit, because of how people have to re-up and they have to report any additional income. But I think the state was trying to fix that. Don't quote me on it, but I think based on the meetings that I've been in with DSS trying to figure that piece out, but we can look into that. But I'm just not sure that it would be held against them, particularly if it's given to go directly to rent. Now, if people are given it and under a different kind of circumstance and it's assumed income, I just don't know.
Yeah, you know, I would just add to that that all of the payments we operate on the service provider side, and we are moving a lot of these funds ourselves. Some of them are Jackie's funds, so we always make the payments directly to the landlords. So it never goes through your household's books, and so I don't think that there would be any tax consequences. Now, if it's a mortgage payment, because that would mean government assistance to pay down your loan. And I think that there you may have some tax consequences and would need to report that in some way. So, but with the rent part, I severely doubt that it would impact your taxes in any way. On the mortgage part, probably needs to be incorporated into your tax plan.
That's great. Well, that is all the questions that have come into the chat. Are there any final thoughts that you'd like to leave us with today?
I just want people to know that even if you're just not sure where to go, please reach out to us. We have on our website, the Caroline, Maryland access point and our main number. So we have people ready to try to answer questions. We are working really closely with the community partners, trying to get this money out to them so that they can get it out to the community. Also, if you just are not sure about your rights, our Office of Consumer Protection is there to help you to try to answer those questions. But Scott was absolutely right. Communicate. If you get that notice or if you're falling behind, try to communicate immediately with the landlord or the mortgage company and document. Write up whatever you can so that even if you wind up having to go to court, and please, if you get a notice, go. Please do not show up, because it is important for you to be able to have the documentation and let them know and negotiate a payment plan. So there are people out there that can help. Our offices can give you information. Also, MCRC is a resource that's out there. Legal Aid and others who are out there who are working on this issue and to provide services. And I'm sure Scott's going to mention 211 is a great resource to try to, at least know where to call and where to go and try to get those resources you need. But I just want to say again, thank you for having me. It's been a pleasure to have this conversation with you all this evening.
And I think it's also a good segue to what my sort of closing point was going to be. The answer is that they need to connect to a service provider. They need to connect to someone in their community, whether it's, just to someone in the community. And any one of those service providers, Grassroots is a great example, can then sort of be their advocate. And Grassroots, the reason I picked Grassroots as an example is so they're connected with folks from the homeless community that sometimes don't have cell phones, and really all that, so the person, the case manager or the point of contact at Grassroots is sort of the person who's getting calls from the assistance agencies, from the folks who are providing, from like DSS or what have you, who are trying to communicate to that individual. They can communicate to the case manager, who then tends to know where the person is and can be on the lookout for them to convey that information to them. But that's the sort of intermediary role that you're looking for, is you need to find a community organization that can be your champion. And that was going to be my sort of, my piece of advice sort of signing off, was that folks who are experiencing duress, starting to get behind on bills, or who are drastically behind on bills, should connect to a service provider. They should get someone in their corner, because I'm always saying that just like you wouldn't want to go into a courtroom without an attorney, you don't want to go into trying to navigate the world of social services and deadlines and paperwork and documents and eligibility without a case manager. That case manager is your attorney in the world of social services. They're going to advocate for you. They know where you're going to be eligible. They can help you with the application process. You want someone in your corner, someone like 211, that all those folks have master's degrees, and there's 20 of them on the other end of that line, and all you have to do is dial 211, or any of the folks that are in Jackie's various agencies would be able to champion your cause and be the experts that you need. And so that's one of my big pieces of advice. And the second piece of big advice, and then I'll be done, is that the earlier the better. Don't wait until a small setback becomes a major crisis. If you start to get behind, start reaching out, because it takes a long time from the moment that you apply until the time that you actually get the assistance. And so you want to get the ball rolling. If you've had a hiccup in reduced hours or significant medical expenses or a job loss or something like that, start asking for assistance, start shopping around. Don't wait until the moment you're going to be evicted, because it's going to be too late. You need to start several weeks or a month before you reach that point, and sort of think backwards. How long is it going to take me to get that assistance and get the ball rolling, get connected? But before you do anything else, you got to connect to a service provider, and that's my big piece of advice.
Keisha, I'm sorry, I did see a question that I didn't answer, and it's kind of important related to COVID. Can I just 30 quick seconds?
Absolutely. I might have missed it. Yeah.
No, it was early on, and I think someone asked, how is somebody supposed to be safe, essentially safely housed or double up when it's COVID, and if they're housing insecure? If you know of people who are there, unfortunately, we know we have families living in cars, we have families living in precarious situations. Please have them reach out to our continuum of care. Please have them reach out to Grassroots and others. If you want to connect with me, I can get you connected with someone. The winter time is coming. We run non-congregate sheltering in a safe way for people who do not have places to live. We don't want them out on the street, in the cold. And we definitely, in this COVID environment, we have created programs and systems for our homeless populations and those who find themselves homeless or without any kind of shelter, to be able to keep them safe in this COVID environment. So if you know of people who need services, please have them reach out. Scott, you made me think about it when you said you just need to reach out and be connected. So I meant to say that earlier. So there are resources for those folks who find themselves trying to be safe during COVID, because there's a lot between that and people who are doubled up. And now we have, our cases of child abuse and neglect, and we have cases of domestic violence and other things, because the stress and the pressure is there. So we want to provide the services in a way that we can keep people safe and keep them in safe environments. So that's it. Thank you.
That's great. I do feel like this, just listening to all the different programs you have is overwhelming in itself. And knowing that they're there, though, is kind of calming. So it's kind of a mix of, where do I go? And I need all this help, but I don't even know where to start. And I feel like this program really helped people to understand there is a place for you to start. A good place, like Scott said, is Maryland 211. Another place, United Way, and also Human Services with Jackie. So again, I do really want to thank you guys for doing this today. That was great. I really appreciate it. And people, I'm sure, have learned a lot from this program. Once again, I am the co-chair of the NAACP Health Committee. And so what I wanted to do is just let you know that we have a survey. If you are interested in helping us put together programs like this, or if you have requests for programs, please go ahead and fill out our survey. I put it in the chat link. It's https://bit.ly NAACP Health Survey. So if you are able to, please fill that out and let us know you were here, let us know your thoughts, and let us know the things that you'd like to get involved with. We are a committee that is very small, but we're able to do these great programs for you, and we enjoy doing these things. So this was actually one of the direct requests from the survey to find out about housing in our NAACP community. So also, I don't know if Willie is still on, but if he is, Willie has put together a great group of people that even the Howard County chapter is available to help you with things that are going on and put you in touch with resources as well. So if you do have a problem, feel free to reach out to us as well. I think that is it. I see a lot of thank you guys for the great words of encouragement. And again, thank you to our panelists. This was great. I think that's it. I think we can end.